If I walked somewhere, I was short of breath. If I talked, I was short of breath. If I did any cleaning around my house, I was short of breath.
Barbara is a retired nurse, enjoying life as a great-grandmother.
Bouncy.
But her breathing was getting worse, and her medicine didn't seem to help. So she went to a pulmonologist, a doctor who specializes in lung diseases. Diagnosed with COPD, she started learning about the many treatments available that may improve symptoms.
In the last 2 decades, we've made enormous strides to improve the outcome and care of patients with COPD, that they can live a fuller and richer life.
For patients who smoke, the first thing to do is quit.
The most important thing an individual can do to help prevent progression of COPD is to stop smoking.
That's easier said than done. Barbara didn't quit right away. Neither did Victoria. She tried quitting 5 times before she finally succeeded.
But I actually quit in 1992. And that's because my granddaughter was crawling around and following me.
Even though quitting smoking also reduces the risk of heart disease and cancer, the addiction can be terribly difficult to shake. Christopher is fighting not only the physical dependence on nicotine, but the way cigarettes fit into his daily routine.
You have to start saying, you know what, after dinner, I'm not going to have a cigarette. I'm not going to have a cigarette when I answer the phone. Then you're on your way to recovery.
With anyone who's facing the challenge of quitting smoking, I think that first thing foremost, they've got to take things one day at a time. They've got to make a commitment and take it one day at a time.
Ask your healthcare provider about the many tools and groups that can help you quit smoking. For example, a range of smoking cessation products or other types of medications may help you quit. Also ask about immunizations. A flu shot every year lowers your risk of getting influenza, which could make your condition worse. You might also consider getting a vaccine against certain kinds of pneumonia.